final presentation of the afternoon is Pete Flynn, who's the nursing director of 10 West, the ACE unit, and Zach, and I always say his name wrong, Widener. I keep trying to, I don't make it as southern as it should be. He's the interactive patient system manager for risk management, and they're going to talk about getting connected, medication teaching at the bedside.
All right. So to fully understand and appreciate where we are, a little background on where 10 West was. 10 West had, prior to us starting this project, an entire quarter for our HCAP scores that were red. So at the time, I sat down with the inpatient manager for Get Well, and we wanted to figure out what was the biggest bang for our buck impacting how we touched our patients and their healthcare needs. So at the time that we identified that there was a need, we were into the end of July, beginning of August of 2015. We identified that we had a real opportunity to utilize the Get Well network as it was integrating more and more into our daily patient care. So we sat down and I decided on one dimension, that dimension being medication communication with our patients. The population for 10 West is largely a geriatric population, so health literacy was not as prominent as you may expect in some other areas of the patients that we touch. So we devised a plan for the 10 West nurses to utilize Get Well to teach patients and their caregivers about prescribed medications and the possible side effects during the course of their hospital stay. When the initial rollout occurred, we identified that each nurse would teach their patients, 4 to 5 patients throughout the course of a 12-hour shift, which was their nursing assignment, about one medication to encompass the side effect teaching, common indications for medication use, and if there were any cautionary information that the patient needed about possible interactions with other medicine. So our method in action, on the Get Well homepage, the teaching points, when you get to the main screen of the Get Well network, in the lower left, if you're looking at the TV, is the See My Medications tab. We would have the patients, families, or in many cases the nursing staff, click on that tab, which would then open up another box where the patients would type in a medication, staff would type in a medication that we wanted to convey information to the patient about. The good thing about utilization of the Get Well network is on the top right there was the opportunity for the green thumbs up to be checked after medication teaching occurred for patients and their families. This green thumbs up indicated not only that the education crossed over to Epic to say that the nurse had gone over teaching points with patients or their families, but it also directed that information, the side effects, why it was prescribed, and any special precautions to their MyChart, which, as we know, our patients that have MyChart, this is a huge opportunity for them to continue to have the information at hand, not only during the hospital stay, but post their stay. The other opportunity on this screen here, utilizing Get Well Network, is the little mail icon with the plus symbol. The mail icon with the plus symbol designated that if the patient did not have MyChart, but they had a family member that had an email address, something to that effect, that the information could still be at their fingertips post-hospitalization, utilizing the function to email the information to them or to one of their family members acting as a caregiver post-discharge. So some pitfalls of the new initiative. The August staff meeting of 2015, all the staff that attended the meeting had buy-in. This is a great idea. We'd be glad to do it. September 1st, 2nd, and 3rd rolled around and we had 0 utilization. So I had some meetings with my frontline leadership to, kind of press the issue and say, we all bought into this. Where's our usage? September 4th, we had 124 medication teaching points for our patients. A little passive aggressive, but we had the good, we had a good kickstart to make up for the 3 days prior where we had none. So the nurses, I think all of us in the room have some people we work with that are initially a little skeptical about new information or a new task. Some of the information from the staff were concerns about, you're making my workload all the more, arduous throughout the course of my day. There was the concern that, aren't we saying enough by telling them the doctor ordered the medication and this is why it's important for your stay? And so I sat down with all my staff again and I said, real quickly, everybody, alive and well today, what would Florence do in this situation? Would she educate the patients, or would we just blow past everything that we've all been taught throughout our nursing careers? So that was kind of the last big shove in the direction I wanted to go that I had to give my staff when they realized that at the end of the day, we were all advocates for our patients and teaching them what was necessary for them to receive optimal care through us. So the first 3 months of our initiative, September to November, the nursing unit averaged 32.3 medication searches per day. A lot of that was staff because we have, again, 10 West population. A lot of those folks are not technology savvy. So a lot of that was and continues to be staff. But the target goal for the nursing unit per shift was 29 medication searches. So for the first 3 months, we exceeded target on what my expectation was for staff. After that 3-month first phase of the project, we started to see some drastic improvements on our unit-based HCAP scores, affecting 7 out of the 8 dimensions with a positive variance that we report to CMS. So it was quite awe-inspiring that we were able to focus so intently on one dimension and have such a positive and profound impact on the whole show. So outcomes by the numbers. Prior to September, our utilization as a nursing unit was 38%. Post initiation of the project, September 1st to January 31st, 10 West alone has seen utilization of 72% with the health information section of Get Well. There comes a time when you just have to print the data out. So if we were printing out the data today, I'm happy to report that 10 West would be averaging over the past 3 months 80 to 85% unit-based health utilization of Get Well Network related to solely medication, communication, and teaching points. So then Zach and I sat down and said, okay, we have to, have some kind of benchmark for 10 West and the rest of the facility. So we were able to compare August to January what 10 West was doing with the utilization of health education compared to our facility as a whole. Each time 10 West surpassed the overall utilization of other nursing units in the hospital, and the bottom graph shows where we were August pre-starting of our initiative to January, where you can see that there was a significant increase in the nursing communication, significant increase meeting benchmark in the medication, and going from majority red with the overall rating to yellow and green with our HCAPS data. So impacting more than medication communication by focusing on this one dimension and utilizing Get Well Network as a driving force, we have and continue to drastically affect our dimensions in our HCAPS, where more often than not we are seeing increases and trending in a positive direction in the majority of the dimensions that we track and report. Any questions? Thank you all very much.